While the COVID-19 pandemic has changed the way we receive health care, telemedicine has become more predominant as many look to avoid in-person meetings, opting for a virtual experience. Patient advocates say it's an experience that may be here to stay.
Doctors have long called for virtual care, and we've called for it because we knew that there was a global want for it.
It's easy access to a medical professional without leaving your home. Telemedicine became a norm back in March when widespread shutdown measures occurred to curb the spread of COVID-19. That's when doctors began holding appointments virtually.
Who does virtual care benefit? And the answer is frankly everyone. Virtual care benefits everyone. And the reason for that is because the way it is currently being instituted, we are able to take some of the load off in-person visits, which right now during COVID-19 is a major win for the system.
Health professionals have been advocating for a wider access to virtual care for years, but were met with pushback from the provincial government, citing that the Ontario Health Insurance Program was not equipped to compensate doctors for most virtual appointments. That is still the case for some even today.
There are cases right now, in particular, some mental health issues and some psychotherapy issues, but there are other codes as well that you simply cannot do. You simply cannot provide that service and be reimbursed for it by the government if it's done virtually, despite it being totally feasible and a reasonable option.
The government has implemented temporary billing codes to ensure doctors could be compensated for time spent on virtual consultations with patients. And while doctors and patients alike seem to value the virtual experience, doctors with the Ontario Medical Association say there are drawbacks, particularly for vulnerable people like the elderly and those with low income who may not have access to technology required.
It's important to flag that virtual care depends upon a familiarity with technology, an ease of access to internet, and really works best when there's a pre-existing relationship with the physician.
The Ministry of Health says 52% of doctor visits were taking place by phone or video when lockdown was introduced. Now, 65% of those visits are occurring in person.